Food triggers, okay, go.
Peanuts.
So these are some mind body therapies which may be helpful. Next, music therapy. This is one of the studies. There's other ones. Next. Did you already next? Acupuncture. There's a bunch of acupuncture studies. Overall, it looks as though it's at least helpful in some way, but there are conflicting studies. Next. Yeah, didn't help. Riboflavin next. Alpha lipoic acid. I think it's good stuff, but we're not sure yet about migraines. Next, coenzyme Q10 is another one of those that people have that shows efficacy along with the magnesium and riboflavin.
Really?
It tends to be a little bit more expensive, and I don't think it's as good as the Petadolax, but I think it's better than magnesium.
If I added it
to
what I'm taking, would it do something?
I'm just going to get poured, but yes, it might help.
I'm poor enough with all these doctors.
It might, it might help. Petasites, which is Petadolax or the butterbur extract. This is the one I was mentioning.
Is this the natural one?
This is a natural.
It's alcoholic extract of this.
What's that?
It's like extract of this herb. Is this liquid? Is this like?
No, it comes. It's in capsules or tablets. Can you go to the next one? So this is how they think it works. This is the study next. Oh, you see that some people took 100, some people took 150, and next. And in the patients who took 150 milligrams, there was a 48% reduction in the attack frequency. One of the big points in this one is this number right here. It's actually, the patients took 75 milligrams twice a day for that dose. And this one, they took 50 milligrams twice a day. It's hard to find the 75s. So a lot of people, I tell them 150, get 75 twice a day.
Split it.
And then, no, 75 twice a day. Oh, split.
No,
Yes, you're
drink
saying,
the pill,
And then
yeah.
they come back to me and say, well, I can only find the 50, so I just took that. But really, you probably should try the 150. And there are, just like most herbals, there are no significant side effects that we know of. Next, peppermint. Okay, next. We already went over that. And next. The clustered menstrual migraine. That's very interesting. One of the things that you should probably know about is just this idea of mini prophylaxis, which is when we treat migraines that occur during the menstrual cycle, or during the menstrual period, just for that period of time. So you would take it, instead of taking preventative medication like the Topamac every day for the rest of your life, you could take a medication just starting 2 days before your period.
It's like Frova, right?
Frova is one of the ones, yes, exactly. I've seen people do it with other things, but yes.
We have the drug queen over here.
I'm sorry, I've had it forever.
And just as a concept that you should just
think
know,
we're part
that
of
you
it.
probably already know, is that migraines that occur during the menstrual cycle tend to be a lot more refractory. They're worse. They're more severe. They're harder to treat. You take your regular medicine, it doesn't work. You have to take another dose. Yeah, they can be really bad.
I was just telling you.
And so sometimes you need either higher doses of medication. Some of my patients take they'll take Maxalt for their regular migraines, but for their menstrual migraines, if they're having the period, they know they need an Imitrex injection because that's like the most powerful one. So sometimes, or you need a different dose sometimes. But the other thing that you can do is mix different types of medications. So you can take. I know I do a lot of this, but you take your cocktail, right? You take your Imitrex and your Excedrin and your nausea medicine and go to bed.
Excedrin migraine that will keep you up.
Well, it has caffeine in it.
Right.
Yeah.
But it's good
It
stuff.
depends. Not everybody, but it is helpful. Next.
As one person.
And-
No problem.
Yeah, right.
When you have migraine.
There are some new things coming down the pipe. There are some newer medications. There's a great medication maybe in a year or two.
Oh, I
This
heard about it.
DHE inhaler is fantastic. This is for avoidance, for getting rid of an attack. And there are also some new preventatives. I just want to say that I'm part of Headache on the Hill, which is an initiative. We go and lobby on Capitol Hill every year. We've done it 2 years in a row. We're going again in February. And the reason we go is because the National Institutes of Health does not give money, essentially, to headache research. And if you look at the statistics about how many people, not just women, I mean how many people suffer from migraine during their most productive years, right? During their years of childhood, child reproduction, sexual reproduction, and productivity in the workplace. We're talking about tens upon tens. The estimate is $30 billion every year is lost to decreased productivity due to migraine. $30 billion. That's more than diabetes, asthma, all of these conditions that get so much money for research, and nobody's out there saying,
Because
hey,
it's a silent
headaches.
illness.
Not
Nobody
just that,
sees
because
it.
I think because for so many years, women suffer more than men, and it takes a back seat. Well, first of all, we used to say it's all men anyway. So I think there's one of the things that we got passed in the legislation was an initiative to actually encourage new research. So they're going to be trying to give some more money to new researchers and to programs to find new treatments. And then, like I said, there's a few different surgeries. There's some neurostimulators and stimulators you put in your head, and this one is big. Eventually, I don't know when it's going to happen, but it's getting a little bit better acceptance and maybe even eventually quantification of complementary and alternative forms of treatment that will move this all along. Next, and this is the last one.
Thank you.
Thank
That's
you.
it.
Oh yeah, those things.
Could you return to the